Hi everybody, Dr. Michael Horowitz, owner of Vancouver Orthotics in the Hycroft Medical Building, Granville and 16th. Today's topic is going to be flat feet and foot pain. So a lot of our patients are coming to our office and they're complaining that they have foot pain, especially when they're standing long hours at work or when they're taking many steps throughout the day. They're telling me that they're experiencing a lot of foot pain. And foot pain can be in the heel, it can be in the arch, it can be in the ball of the feet or around the toes. And so it's not an uncommon symptom that people experience. And the question that I always like to ask is, where is it coming from, right? So just to show you, the foot is made up, each foot is made up of 26 bones. And those bones have a specific alignment and position that they ought to be in. When they're not in that position, there's a chance of poor shock absorption with each step that you take. Now, in our society, we're encouraged to take as many steps as we can each day. They say we should take 10,000 steps a day. That's great. I agree with that. However, if you consider that a 150-pound person that takes 10,000 steps a day, that's equivalent to 1.5 million pounds of pressure through your weight-bearing joints each day. So a weight-bearing joint are your feet, your ankles, your knees, your hips, your back, your spine. So if you're experiencing symptoms such as foot pain, ankle, knee, hip, or back pain, without any specific event or specific traumatic event, then you might ask yourself, maybe this is coming from my feet. And at our office at Vancouver Orthotics, that's what we do. We take all patients through a 3D foot scan, an electronic gait scan, a postural assessment, a few other orthopedic tests to determine, are these bones of your feet lined up as they should? And if they're not, how can we best support that? So we create a pair of custom orthotic inserts designed specifically for your feet and for the type of footwear that you might be wearing them in. For example, if you're wearing high heels, if you're wearing flat casual shoes, or if you're wearing running shoes or sport shoes, we have a different type of orthotic depending on the activity that you're engaging in. So the other interesting fact about your feet is that each foot is made up of 4 different arches. There's an inside arch, the medial longitudinal arch. There's the outside arch, the lateral longitudinal arch. There's a transverse arch by your heel, and there's a metatarsal arch by the ball of your foot. These 4 arches work together, and when one or more of them are flattened, too flat, also known as overpronation, or if they're too high, which is oversupination, that can really affect the way your body absorbs and disperses weight and pressure. And that can definitely be a source of why you're feeling foot pain. So there's information today about flat feet and foot pain. If you're experiencing any of those types of symptoms and you're in the Vancouver area and you're looking for some answers, you're looking for some treatment, some diagnosis as well as treatment, then please visit our website at vancouverorthotics.ca. You can book an appointment online, or you can email us with any questions that you may have, or you can call us if you prefer to schedule an appointment. We're at 604-737-3668. Once again, my name is Dr. Michael Horowitz, owner of Vancouver Orthotics, happy to help. And we've got a lot of other really good videos, stretches, exercises, and information about the conditions that we treat. So feel free to subscribe to my YouTube channel. And if you want updates, then just click the bell button and that'll let you know when my next video comes up. Thanks again, everybody. Have a great day and keep moving and keep well.